today we're going to talk about a plank, especially a plank when you have scoliosis. Addie is helping me demonstrate how to do a plank with scoliosis. She does planks way better than I do, so I'm using her as a model for this. And behind Addie, we have a plank wall of fame. On that plank wall of fame, we have the amount of time that different patients have done a plank. And it is something that's helpful for stability and strength. It's not something that I want someone to go for an hour or 2 hours or even 10 minutes on, because the first minute or two is actually really good for strengthening, but then when you get past that point, then it's just torture, right, Addie? So we're not going to do anything for 10 minutes right now, but I want to show you what to look for with the form and specifically with scoliosis. So the plank that we're going to do is on your toes and on your elbows. And so Addie, go ahead and on your, you can put elbows there. Good. So Addie's already in a plank, good position. I want to see that her low back isn't too arched. Can you arch your low back a little bit? So we don't want to sag down like that. We want to keep that up. So bring it back up there. I don't want to see that we're sagging down here either. And that's shoulder blade stability. I want the shoulder blades to be stable. Can you bring this down a little bit? Yeah, so we don't want to see that. I want to see that she's nice and stable through the shoulder blades, so push back up. Right there. Good. And I want to see that she is nice and straight like a plank. That's why it's called a plank. If I keep talking, we might be able to get to our 5-minute plank here, Addie, or something like that. But we want to maintain this position. If we start to see the low back arching or there's pain or anything like that, then we stop, because I don't want to go through a compensation pattern. Go ahead and relax down there, Addie. So usually I'll have them hold this not as long as they can, but as long as they can hold it with good form. And so let's go back up into that plank, Addie. Addie has a left lumbar curve, and with her pelvis, we want her pelvis to not be rotated one way or the other. And so that's something to watch. We want the pelvis to be nice and flat, kyphosis to be as little as possible and not arching the low back. And then we can also work on some derotation of the spine. She doesn't have a whole lot of rotation in the spine, so we're not going to worry about that. But we want to keep things as symmetrical as possible. You can go and relax. And with scoliosis, we're looking for symmetry. So symmetry in the pelvis, in the lumbar spine, trying to keep that nice position with the plank. Thanks, Addie, for helping us out. And planks are great. It's a great exercise for core stability and strength, and we do them with most of our scoliosis patients, but we need to do them with good form. So thanks for watching. Let me know in the comments if you have any questions about how to do a plank, or you have specific questions on how you are doing a plank. So thanks for watching. We'll see you next time.